Welcome to today's webinar on the overview of the new regulations for health and fitness centers that come into effect this Friday, July 24th. My name is Isaac Reichman. I am the Director of Public Information at the City of Chicago Department of Business Affairs and Consumer Protection. A little bit of housekeeping before we get started. Please, if you have any questions over the course of this webinar, I will pause a couple times for questions and also hopefully have some time at the end to answer those questions. If you have any questions, please use the chat function on the webinar in order to submit those questions. I'm typing into the chat right now, so please, I just told you to use the chat for questions. So if you have any questions, please submit them there. Do not use the Q&A. If you use the Q&A, I will not see those questions. Also, you'll see on the bottom of every slide over the course of this webinar, BACP outreach at cityofchicago.org. If any of your questions aren't answered, or if you have any additional questions that you do not ask over the course of the webinar, I'll ask that you please follow up via that email. Again, BACP outreach at cityofchicago.org. And me or someone from my team will follow up shortly with a response to your questions. This webinar will be recorded and it will be posted on our website. It should be posted by the following day, so it should be posted by tomorrow. You can find that at our website where you access today's webinar. That's chicago.gov/businessworkshops. And then you can also find it on our YouTube page. That's youtube.com/ChicagoBACP. So an overview of what we are going to cover today. First, I'm going to give a little bit of an update on the COVID-19 data and why we need to make the changes that will come into effect this Friday. And I'm going to talk specifically about the new restrictions that come into effect on Friday. Then I'm going to talk in more detail about the Phase 4 guidelines for health and fitness centers as a whole. And finally, I'm going to talk about enforcement and operational requirements. Again, I will have some opportunity for questions, but if I do not get to every question over the course of this 30-minute webinar, you can email us at bacpoutreach@cityofchicago.org. As a reminder, it's right there on the bottom of every slide throughout this webinar. So before I get into the new restrictions, I want to take a minute to talk about why we're here and why we do need to roll back a couple of the restrictions effective this Friday. First of all, I want to make it very clear that throughout this entire process, since everything really started in March, data has been our North Star. Everything we do is because the data tells us that is what needs to be done. So as you can see on this top chart, on this top graph here, the daily case rates have gone down significantly since our peak in May. However, as you can see at this bar at the end, at the line at the end, they have started to rise, especially over the last few weeks since we transitioned into Phase 4. And as we said, is when we transition to Phase 4, if we do see a rise in cases, we will need to roll back a couple of the guidelines. And that is what was announced on Monday, and that is what will be coming into effect on Friday. So as you can see on this bottom with the numbers, we are now over 200 confirmed cases. That was always kind of our threshold number, that we were ready for Phase 4 because we went under 200 confirmed cases in a day, but we're now back above 200 confirmed cases. And that's why, since we went above 200, that is why we are adding a couple additional guidelines. And I ask everybody to please visit chi.gov/COVID- in order to get updated on this. I look at this data every day. I know we have folks in our health department that are looking very, very closely at this and at all the detailed data to make these decisions. So I do see a couple questions coming in related to a little bit more about the data and about why these decisions were made. Unfortunately, I'm not a health expert, so please do send us an email to BACP Outreach, and I can connect you with some folks in the health department that can help answer some of those questions. But please, I recommend everybody take a look at what you see there. And again, every decision that's made is all about what the data says. Great. So I do want to remind folks that we are still under phase 4. While we have made some changes to what phase 4 looks like, we're still in this gradually resume section. So the goal is to still be open and to still continue reopening, but to do so with the safety of residents as our primary North Star and our goal, which is why, as the cases have spiked, we have had to roll back a couple of the guidelines for phase 4. But we are still under phase 4, and if the data improves over the next few weeks, we may be able to add back in additional some of the guidelines that we're rolling back now. We may be able to add back in over the coming weeks. So, what are the new regulations? I'm going to quickly provide an overview of the five changes that will be coming into effect. Again, these are coming into effect this Friday, July 24th at 12:01 a.m., so immediately on Friday. First, indoor service is no longer allowed at any establishment that serves alcohol without food. So bars, breweries, taverns that do not serve food can no longer have indoor service. Table seating at restaurants, bars, and other similar establishments will now be limited to no more than 6 people. It was 10 people in the past, it is now 6 people. Personal services like hair salons, makeup, things like that, can no longer offer services that require the removal of face coverings. And then our focus for today, which is why it's highlighted here, health and fitness centers may no longer offer classes with more than 10 people. And then finally, residential property managers will be asked to limit guest entry to 5 per unit in order to avoid indoor gatherings and parties. So this is an overview of everything that will be coming into effect this Friday. So now I'm going to talk a little bit more detail about this new regulation specifically for health and fitness centers. Then I'm going to go into even more detail on the entire guidelines for phase 4. So as you saw on the previous slide, indoor classes at health and fitness centers are limited to no more than 10 individuals. And I see a couple questions already come in related to this. That number 10 does not include the instructor. So you can have 10 participants and then also an instructor as a part. So you could have a total of 11 individuals within that indoor class. This applies to gyms, fitness centers, yoga studios, dance studios, cycling studios, strength and conditioning studios, really anything that fits into that broad bucket of health and fitness centers. Outdoor classes are not subject to this restriction. So outdoor classes, which I'll get into a little bit more on the next slide, they are not subject to this restriction. You still can have outdoor classes as you could under the existing regulations for phase 4. This applies to classes only. Again, classes only. Independent activity or one-on-one training in the general gym area is still limited to 25% capacity or 50 people, whichever is fewer. So this new regulation is specifically for classes. So any sort of, a spin class, a yoga class, anything like that, weight training class, any sort of class is limited to no more than 10 individuals. But general training, general exercise, like an open dance studio or an open fitness center, that is not a part of a class, is limited to 25% capacity or 50 people, whichever is fewer. So again, I'm going to open it up for a couple questions that have come through related to this, and then I will move on to a little bit more about the phase 4 regulations. I have a question: if we are cycling outside, does the new restrictions apply to us? No, the new restrictions only apply to indoor classes. Okay. If we have a dance studio, are they under the same guidelines for health and fitness? If they are for youth, yes, you are under those same guidelines. If you look also at the city website for reopening guidelines, there are guidelines for youth activities, and those youth activities also have that same 10-person restriction per group or per class. So that might be different than school standards, but youth activity guidelines are that same 10 people per class. Okay. Does this apply to gyms with open air training? Yes, it does. Even if you have garage doors open in your gym, if it is indoors, it still is under this new restriction. Can a dance studio have 10 participants, one instructor and one pianist? Yes, you can have, theoretically multiple instructors or multiple different kind of instructors, as long as you have no more than 10 participants. Right? Questions about limiting class size to no more than 10 people, regardless of the gym size. Again, this is a restriction in place regardless of gym size. We know that classes can have people in close proximity, so it is limited to no more than 10 people. Great question. And just to clarify, indoor class size is also limited to 25% capacity or 10 people, whichever is fewer. So if you have a small space and you cannot have, you can't even fit 10 people without going above your 25% capacity, that would not be okay as well. So that 25% capacity is still in place as well. I had a question about if that 25% capacity includes the class and independent training. So if the class is in the same area as that independent training, then you should consider and you should use 25% capacity or 50 total people across the independent trainers and the people that are part of the class. However, if the class is in a separate room, each separate room should have that 25% capacity or 50 people if it's independent, and no more than 10 people if it's part of a class. Okay. Had a question about a large building capacity. Even if you have a large building capacity, you're still limited to no more than 50 people or fewer. That is the same as what the existing phase 4 guidelines are, 25% capacity or 50 people, whichever is fewer. I had a couple of questions about the data specifically to fitness. I'll ask you that you please reach out to us at BACP outreach at cityofchicago.org, and I will connect you with some folks in the health department that can talk a little bit to this. Question about the 25% or 50 people max capacity. That if that is in the whole building or in each space, that is in each space, provided that that space is entirely separate. You can't just say, 25% capacity in this corner, 50 people in this corner. If you're all in one location, then you should consider that as part of the entire capacity. So it's not just kind of designated areas in a room, but if you have entirely separate rooms, then each one, or floors, for example, each one could have 25% capacity or 50 people. I had a question if I could provide the site for youth sports. Please visit chicago.gov/reopening, and I just added that into there. Please visit chicago.gov/reopening if you want more information on youth activities and things like that. So now I want to talk a little bit more detail about these guidelines here. And I did want to provide a little bit of clarity for gyms, and I did have some a mistake on one of those points I mentioned earlier. I did want to take a step back and provide a little bit of clarity. The guideline is 25% indoor capacity with a max of 50 people at any kind of one indoor gathering. So if you do have a larger space that does have room for a lot of independent workout, you can have your indoor capacity at 25%, and I do apologize, you can go over 50 as a part of that in your large indoor space. So I do apologize for that, but your indoor capacity is limited to 25%. If you have a large indoor space where everybody is working out independently, you can go over 50 people. So I do apologize for that, and thank you for that clarification on that. And I will remind you of that again. So I do apologize for that clarification. So I do want to provide some updates here on all of the guidelines. You should be ensuring at least 6 feet between individuals and close choke points. You should be ensuring 6 feet of distance between all individuals, including during one-on-one training. You should be providing 6 feet of distance also between equipment. 3 feet of distancing is allowed if impermeable physical barriers are being used. You should be limiting indoor capacity to no more than 25%. And indoor fitness classes, again, here's our key change, limited to no more than 10 individuals, with outdoor fitness classes limited to no more than 100 individuals with proper social distancing. Locker rooms and showers can be open. Other ancillary accommodations can remain closed, such as saunas, steam rooms, and hot tubs. Contact and non-contact sports are allowed indoors with no more than 10 participants. Protective gear should be worn by all employees and customers. Face coverings must be worn over the nose and the mouth, including during indoor physical activity. So anytime you are indoor, face coverings must be worn, any class, anything like that. For outdoor physical activity, face coverings or classes, they may be removed as long as individuals are practicing social distancing. You should be providing sanitizing products for customer use. You should be decommissioning water fountains unless they are used just to fill up water bottles. You should be encouraging employees to complete a health and safety training related to COVID-19 when they are returning to work. Finally, you should be requiring employees to wash hands before and after every one-on-one training. And again, I want to clarify because I misspoke earlier in this presentation. Indoor capacity is limited to no more than 25% for your open gym areas. That is more than there is not a 50-person limit on your indoor capacity. You must be at no more than 25%. And that is per floor, per room. So if you're in separate workout rooms, for example, each one can be up to 25% capacity. Again, I apologize for misspeaking earlier. Happy to follow up for clarity on that as well. You should be implementing screening measures for employees and customers. At minimum, employees should self-screen to ensure that they do not have symptoms of COVID-19, and they should not be coming to work if they have any symptoms. Now, you can certainly do more. You can have temperature checks before people come in, things like that, but that is not a requirement. At minimum, you should be doing a self-screen. You should also encourage participants to come to the facility dressed in exercise clothes. While locker rooms can be open, you should still be encouraging participants to come fully dressed for exercise. You should be establishing daily cleaning standards for spaces and high-touch items. Disinfecting supplies should be available. You should be discouraging any sort of shared instructor equipment, and cleaning and disinfecting, hopefully you're doing this anyway, any shared equipment. You should be providing visual guidance for hygiene standards throughout your facility. You can find this guidance at chicago.gov/coronavirus. And post guidelines and criteria for customers to enter, social distancing guidance throughout that. You should also, and I saw a question come in about pools, indoor private pools can reopen at 25% capacity, and outdoor private pools can reopen at 50% capacity. Face coverings and PPE are not required while individuals are in a pool. Finally, you should be minimizing in-person interactions as much as possible. So consider still using online trainings, virtual staff meetings, things like that. Minimize client overlap as much as possible. One client per employee without any scheduled overlap. Um, Ideally, A and B shifts for workers where possible. You should be limiting staff travel across multiple locations because if you have multiple gyms, the less kind of people you're interacting with, the better. And then finally, you should be following health and CDC guidance for testing and tracing protocols. You should be prepared for somebody potentially contracting COVID-19. Must follow all CDC guidelines before returning to work, cleaning and disinfecting the workplace. And if you have close contact with a coworker or any other person who's diagnosed with COVID-19, that employees should be self-quarantining according to the CDC guidelines. Finally, if you become aware of 2 or more cases possibly associated with an establishment, then you are encouraged to report those cases to the health department. You can find more information on that. Again, I just typed it in, but I'll do so again at chicago.gov/coronavirus. You see a couple questions coming in. I want to kind of remind everybody before opening it up for additional questions that that this is something that will be and will continue to be enforced by BACP. We will be and we will continue to respond to complaints and also proactively canvass. We're kind of focusing on entertainment districts for our proactive canvassing, but we certainly will be potentially proactively canvassing health and fitness centers, gyms, other places like that. Citations for failure to follow these guidelines, for failure to have face coverings on when indoors can lead to fines. And we have issued citations and warnings specifically to gyms around the city. To date, we've already conducted over 600 reopening investigations, and we have cited 36 businesses. We've also ordered the closure of 2 businesses so far. So this is something that really needs to be taken seriously. These aren't just suggestions. These are requirements that BACP has been, and will continue to enforce. Finally, I will provide a little update, take an opportunity to provide you with some general updates for all businesses. There is legislation that is pending that will actually be voted on today at a city council meeting that's going on right now that will extend the license expiration for all licenses that expire between March 15th of this year and September 30th of this year. Basically, we will not be, we don't want your license renewal to be a burden right now. So you do not need to worry about renewing your license if it expires between March 15th and September 30th of this year. So you can renew those licenses, again, pending a vote on this today, but we do expect that it will pass. You can renew without paying a late fee until October 30th of this year. I also want to point you all to chicago.gov/coronavirus for the latest information on the emergency travel order. The city announced yesterday that Kansas has been added to the list of states for which travelers must quarantine. Please continue to visit that website. And for the latest updates on the emergency travel order. Again, I want to take a minute now to answer additional questions that have come in. What issues specifically can be cited or fined, as some things you said were recommendations? It's a great question. Yes, some of the guidelines specifically say we encourage you to do this. It is a recommendation to do this, for example. So we're not going to issue you a citation for something that is a general guideline, is a general encouragement. For example, we encourage folks to have temperature checks, but that's not a requirement. We'll not cite you for not doing that. We will, however, issue citations if customers or employees are not wearing face coverings, or if you have more than 10 people in a class. So the things that are, or if you're over 25% capacity in your main area. I had a couple questions about statistics on COVID cases related to gyms and on other data, other background. Again, I'm going to have to check with our health department on those questions, so please do not hesitate to reach out to our outreach email, and we'll be following up there. Great. Will these additional restrictions be lifted if positive case numbers reduce? We're certainly hopeful that if the cases do reduce, we will be following up, and taking back some of these restrictions. As those cases go down, that I recommend you all to visit our COVID dashboard. 200 is kind of that threshold, 200 cases per day. Once we get back below 200, that's when the health department has said we will look at regulations and see what might be able to change back to what was our original phase 4. Now there's a lot of other factors that go into it, so it's not something definite, obviously, but we would look to those numbers as our main thing. Okay. I have some questions about about how to exactly calculate capacity for gym businesses. Again, your regulation is 25% capacity for each room, each space, each floor. For a space to be considered entirely to have kind of a separate capacity, they really need to be entirely separate locations. So, again, I'm not the health expert, but it's all about the exchange of where folks could potentially be in close proximity and exchanging germs. So it's up to you, the business owner, to determine what is kind of a separate location and can have that separate 25% capacity calculation. But they really need to be entirely separate rooms, entirely separate spaces, not just different areas of the same room. But if you have any questions about kind of exactly how to calculate that 25%, please reach out to us at BACP Outreach, and we can get you some answers on that. Had some questions. Where can I find all of the recorded webinars? I'm going to type it back in, chicago.gov/business workshops. We should have yesterday's webinar up by today, and then this webinar should be posted by tomorrow. Okay. What do we do with members who refuse to wear masks or tell us they can't wear masks because of medical reasons? So it is your responsibility as a business owner to make sure that people are not in your facility without wearing the required face coverings. And that's, you as a business owner should not be letting folks in if they are not able to follow those rules. So you can absolutely, and you should be, denying entry. Again, specific questions on the square footage, that's something, please do reach out. I know we had talked specifically in some previous webinars about that. That is something that is provided by our Department of Buildings. So I want to be able to make sure to give you accurate information. If information that was provided on previous webinar is still the accurate calculation, but I do just want to make sure I'm giving you the correct information. So please reach out via email for that question, and I'll get you an answer. Had a question, is fitness essentially being characterized as entertainment businesses now? How do gyms relate to bars? No, they're not being categorized as entertainment businesses. They're obviously separate locations. But we know from our data and from looking at data all around the city, all around other states and other cities, that folks exercising in close proximity, just like folks at a bar indoors in close proximity, just like personal services when you remove face coverings, these have a high potential to spread the disease. So this is, again, something that we rely on our health department in order to make these calculations and these recommendations. But these have been identified as the highest risk places, and we will be, which is why we're focusing on rolling back the guidelines here. Clarity on what is included in contact sports. We don't have a formal definition of a contact sport. You can think of it as any sport in which participants have contact with each other. And what about equipment during classes? Equipment should be, you can use equipment during classes, but it should be cleaned and disinfected thoroughly between usage. Okay. Had a question, is a mezzanine considered a separate floor or space? Again, that's something that you, business owner, will need to calculate. I will not be able to answer that without kind of looking specifically at what the space looks like, but they should be entirely separate locations that do not have any sort of interaction between people. If someone is working out alone indoors, does the person have to wear a face covering? If they are working out indoors at a health and fitness center, then yes, they do need to wear a face covering. Even if, if someone is obviously working out in their own private home indoors, they do not need to wear one. But if they are in a health and fitness center, then you do need to wear a face covering. Are you saying that if we are socially distanced within the facility, masks will have to be worn? Yes. If you are socially distanced within the facility, masks still need to be worn. This is an absolute requirement. Anybody that is indoors at a health and fitness center, whether you're working, whether you're cleaning, whether you're exercising, it does not matter. You do need to wear a mask. Again, a couple questions about the data. I'm not the data expert. I'm not the health department. I rely on the health department for that. Please send us an email to bacpoutreach@cityofchicago.org. We are a little bit past time for this webinar. Please reach out if I did not answer any of your questions to bacpoutreach@cityofchicago.org. Again, just as a reminder, just as a reminder of the main guidelines that must be followed as part of this rollback of restrictions. The only change to the phase 4 guidelines for health and fitness centers is that indoor classes must be limited to no more than 10 people. Other than that, you should be following the phase 4 guidelines that have been in place since the beginning of phase 4, which began on June 26th. Those guidelines include wearing face coverings, limiting indoor capacity to no more than 25%, and to keep 6 feet of social distancing between people and between equipment. Again, if any question that was not answered, please do not hesitate to reach out to BACP@cityofchicago.org, and I will make sure to get those questions answered as soon as possible. Thank you all very much.